Nice to see ya.
Good to see you as well. I apologize for my technical delay.
That's okay. Hey, it's cool that you were in Ask a Surgeon to answer questions too. So that was a good moment for me to highlight what you were doing on the other side.
Perfect, perfect.
All right. So now that I got you, I have 10 questions. I've been asking ladies, like, what do you want me to ask you? So I narrowed it down to 10. So it's kind of like summer breast dog, little mommy makeover, but a lot kind of highlight recovery, which kind of surprised me. So
Perfect.
without further ado, I'm going to ask you the first question.
Let's do it.
All right. So first, what made you want to be a plastic surgeon?
So plastic surgery for me, I think I have always been interested in the creativity aspect of it. I like the fact that with plastic surgery, there are many ways to do something, and it's not necessarily one way. You kind of get to pick your way, and you kind of get to improve upon that and kind of introduce that to, to other colleagues and to other patients, and kind of finding certain ways to take care of one particular problem in many ways. I love that. Love that aspect of it.
That is cool. So you went in knowing you were going to be a plastic surgeon?
I did not. I actually thought I was going to be a cardiac surgeon in the beginning, but because I like doing very technical stuff. But cardiac surgery was they're very technically sound, very routine though. In terms of they do it's the same thing kind of over and over. And with plastic surgery, I get to do something different all the time, and I get to be a little bit more creative, and I love that aspect of it.
That's so cool. Well, I'm glad you didn't become a cardiac surgeon.
Me too.
All right, next question. This one's pretty specific. So this lady said she has broad shoulders, and she's wondering if a breast augmentation will make her look even wider. So I think that's a lot of concerns women have, is they don't want to look bigger than they want to be.
I actually think that it works the opposite way, because I do think that one thing you have to keep in mind when you are wider is that obviously it means that your chest footprint is wider. But by adding an implant, I actually think that you create more of a feminine physique. You create a little bit more curve kind of beneath the shoulders, so the emphasis kind of drops down from the shoulders towards the breast. And it also then accentuates the waistline, so thereby giving you a little bit more of kind of an hourglass shape, particularly if you kind of are able to work on areas of the hips as opposed to kind of that upside down triangle.
Yeah, I don't want to be an upside down triangle.
Yeah, nobody likes
that. Next question is, will I be able to drink water and eat on my own post-op from a breast augmentation, or do I need someone to help feed me?
You are encouraged to do everything on your own. I think that the more you can move your arms, I think the better off you will be. We particularly here have a lot of rapid recovery exercises, kind of encouraging you to move your arms, because once your shoulders get stiff, it's really hard to come back from that. So the short answer is you will be able to feed and do everything for yourself, and you are encouraged to do those things.
I hear a lot of women say that they pick up food on the way home from surgery, and I'm like, well, I know they're feeding themselves.
For sure. Yeah.
So the next question is, will I need help going to the bathroom post-op? So this might be dependent on the procedure maybe, but will I need someone to wipe me?
Yeah, probably, again, depending on the procedure is likely has something to do with this, because again, if we're kind of getting real with it, like if you have a tummy tuck, right, it's a little bit harder for you to say twist around kind of to the backside for kind of wiping yourself with the restroom. It's also harder to get up, right? Like I think that's a simple thing that people often overlook. Like if you're sitting in a lazy boy or on the bed or whatever, like you have to actually get up and then walk to the bathroom. So you will need some help with that, right? But then once you're in there, again, I encourage you to do as much as you can by yourself, because you want to be able to move. You want to make sure that you're nimble. But if you need help, again, whoever it is that's taking care of you, I'm sure is more than happy to help you out. But do as much as you can so that you can remain as mobile as you possibly can.
So I remember when I had my most recent breast or implant exchange with liposuction, they told me like the more I could get up and walk around, the better. So what is the thought behind why women should get up sooner than later and move around?
One, when you get up, say you have a tummy tuck, right? Like when we send you home, really the big reason for you to get up and walk around is make sure you don't get blood clots in your arms and your legs. The more you move, the more those muscles pump, the more you kind of squeeze blood back. That will help you to prevent that kind of big complication. Right. Then on the other side, the big thing for moving is I think it makes you feel better, right? Like I think when you sit in one location for hours on end, right, your muscles get sore, your joints get sore, your buttocks and things are sore just from sitting on it, right? Or if you got a BBL and you're laying on your chest, right, your chest gets sore just from kind of laying on it. So you want to get up and move, and that way make sure all your joints and things stay nice and soft. I tell people, go for a walk, right? I remember people asking questions like, well, what happens if I walk on a treadmill? I was told not to walk too far. For me, like walking in your house is just like walking on a treadmill, right? Just walk, right? However much you can walk without running, walk. I think is very good for you. You can't really walk too much. It's kind of the short answer to that.
I like that. That's good to know. How about, do I need to lose weight before surgery? Like, what's the weight amount that you would say, like, be within?
This is a hard and complicated question because it has two answers, right? So first thing is you have to have a certain weight to height ratio in order to have surgery, period, right? Like the surgery center here or at other surgery centers, like there's a certain cutoff. Everybody talks about the dreaded kind of BMI. You have to be a BMI less than a certain number in order to even be a surgical candidate. The reason why is because of a safety issue, right? We want to make sure you're safe for anesthesia and make sure just in case there's some problems that we have the tools and equipment to be able to take care of you. Once you met that criteria, the next question then becomes about weight loss and results, right? Because it's about how durable are the results. If I do something and I tell patients and I get it spectacular, I mean, it's a home run, you love it, never seen anything better. And then you lose 20 pounds, and all of a sudden things may sag just a little bit. It may not be as tight as it was. Things may not kind of sit at the same level. So in those situations, I tell patients, if you want to lose 10 pounds, after surgery, I think that's pretty good. I think you actually often will look better because it kind of helps tone things. But if you lose 15, 20 pounds after surgery, just be prepared that things may look different. So if you are hell-bent on losing that much weight beforehand, I think it's a good idea to lose the weight and then kind of come back and do the surgery later. And then we can kind of tone things to where you really want to be.
Okay. Is that the same like for all procedures or like breast aug versus a tummy tuck?
I would say that it's the same for like all procedures because the hard thing is that genetically, just like you can't tell yourself where to gain weight. People are like, oh, I wish I could just gain weight just in the buttocks or gain weight just in the breast, right? You can't tell yourself where to lose weight, right? And so like if you are an individual who loses all of their weight in their breast, and I do a breast augmentation and it's fantastic, and then you lose 20 pounds of breast tissue, they're not quite going to sit where they sat when we first did it. And you may be totally fine with that and you may not. And so we just have to know that going into it.
I like that. Good to know. All right. Mommy makeover question. Well, not really. I want a mommy makeover, but so scared of the anesthesia and not waking up. So do you know any statistics around anesthesia or the differences between general? I don't know. Let's calm her nerves.
Let's calm her nerves. So I'm going to approach this question twofold, right? The first thing I'm going to say is that outside of statistics and numbers, because oftentimes I think people get caught up on those, I think that general anesthesia for you, if you are a healthy individual, is incredibly safe. I do it as a operating surgeon, and I certainly wouldn't do it if I thought it put you at risk. I have had children who have had surgery. I've had other family members who have had surgery, right? And have felt totally fine with it. So if you are a healthy individual, then I think general anesthesia is perfectly fine for you. Now, is that risk zero? No. But neither is the risk of driving your car to work. Neither is the risk of flying on an airplane to go to that beautiful vacation down in Jamaica, right? The risk, if you want to look at, now I'll shift to the people who are totally numbers oriented people, right? So if your risk in general of mortality with a general anesthesia is somewhere between 1 in 200,000 to 1 in 300,000, depends on kind of look at. That is actually safer than getting on an airplane, which sometimes, depending on which numbers you look at, it may be around 1 in 10,000, right? But, we tend to overestimate risk, I think, that we don't deal with every day and underestimate risk that we deal with every day. Actually, flying an airplane is safer than driving your car, right? But you drive your car every single day, right? So you don't really think about that. So in summary, I think that your risk of concern, your concern are totally valid, right? I understand it because I have concerns as well. But I think that you're safe. And I think that that's the whole point, is doing it in an accredited facility with accredited anesthesiologists or nurse anesthetists, and just making sure that it's a place where all of these things are taken care of. If you do it in certain situations where they don't have anesthesiologist, and maybe it's the plastic surgeon who is kind of trying to maintain your anesthesia, that's where your risk goes up. I don't consider myself an anesthesiologist, and I would never do anybody's anesthesia because I wouldn't do a good job, right? But I trust the anesthesiologist that we have here, and so here I think you're entirely safe.
I like that. Good to know. Linda asked a question, so I want to make sure I answer the people who pop on and comment. So how long are you supposed to feel right? How long are you supposed to feel real right after a mommy makeover?
So
when you gotta feel real.
Feel real. So let me see if I can kind of read in between the lines there. So, let's imagine she says feel real tight, right? And so you will feel tight after a mommy makeover for several weeks because of the belly surgery. For most people, like, you want it to be tight, right? Like, you want me to bend you as much at the waist as I can to get out as much as I can. And so for some people, the tissue kind of tends to stretch out in about a week. They may be standing upright. And for other people, 2-3 weeks. And that's okay, right? If you're on the 2 to 3 week end, that doesn't mean it looks like, yes, real tight. So I got it right. It doesn't mean that there's any type of problem, right? Like, some people, their back kind of trying to get yourself back to normal, and somewhere in that 1 to 3 week range, most people tend to feel pretty good and kind of start to feel a little bit more normal.
I got another question that just popped down in here. Talk hernia repair and tummy tucks.
All right. Well, so I will talk kind of my prior experience, and I'll talk my experience kind of here. So with hernia repair and tummy tucks, some plastic surgeons do not feel comfortable really at all doing kind of any hernia repair, right? And so what you would do is that you would have a plastic surgeon who would coordinate with the general surgeon, and then together they would then figure out how to do the tummy tuck and then do the hernia repair. That's totally fine. No problem with that at all. It's what I actually did before I came here. I also kind of in my training did do hernia repairs, right? And so in a situation that now where like the setup is a little bit different in terms of access to general surgery, if it's a small hernia repair, I'll do it myself. I feel totally comfortable with that. And when I sent them into other general surgeons, they say that for small hernias, I will do it the exact same way that the general surgeon will do it. If it's a large hernia and there's a chance that you may need mesh or you may need something more involved, then I will send you to a general surgeon to have your hernia repaired and then have you come back for the tummy tuck. Just because they are more qualified, and for larger hernias, that is who you want doing your hernia repairs, who I would want doing my hernia repair in that situation.
Right. So it really just depends on the severity of the hernia.
Yes. Depends on the severity of the hernia, and it depends on then the comfort of the plastic surgeon, for sure.
Another question come in here. BMI question. The doctor will take into account the person and not just the number, correct? For example, higher BMI due to muscle. So how does that work?
Yep. So that is, the individual is absolutely correct that your BMI does elevate if you are more muscular as opposed to having more or less muscular compared to kind of subcutaneous tissue. But across the board, unfortunately, you do just have to have, and again, this is an accreditation issue. You do have to have a cutoff as terms of what you can do at an outpatient center, right? So at a hospital, I can do any BMI, honestly, that I felt comfortable with and that anesthesia felt comfortable with. But in an outpatient center, just like there's a limit to how much liposuction I can do, there's a limit to what my BMI can do, what my BMI can be. And again, that is for patient safety, and that is because of access to various life-saving tools, kind of if I needed them. So that's the reason for the BMI issue.
That makes sense, especially the accreditation part, like staying within guidelines. Staying
guidelines.
Makes sense. All right, now go back to these over here because we got 8 minutes, and I know you're a busy man. I have super red thick scars and I'm 2 years post-op. What are my options for reducing scar visibility?
That's a hard one. So if it is just redness, then this far out, laser therapy is a good idea. You're kind of far out to start talking about things like silicone therapy. You could try silicone sheeting. You could try silicone kind of topicals that, and massage. But 2 years, the scar is pretty mature. Honestly, what I would say is that if you don't have a history of keloids, and you think that it is just because either the scar, you had, the wound opened, which happens, and you needed to do some wound care, or it was just under a lot of tension, and now you have some extra skin. A scar revision followed by really good treatment of the scar with things like silicone sheeting, silicone massage. Another thing is if the scar is really thick, then you can use steroids. But again, 2 years is just it's kind of far out. And oftentimes with steroids and keloids or hypertrophic scars far out, I may be able to get rid of the itching and I might make it slightly flatter, but it will not make the scar narrow. So it just depends on kind of what your goals are.
What if someone is predisposed to developing keloids? Like, is there something they can do ahead of time before surgery or keep in mind afterwards?
Keep it in mind afterwards and then really paying attention. So sometimes when people have been predisposed to keloids, what you will do is that after you do the incision, once the incision has healed and you're pretty happy with it, maybe at around a week or so, you can come back and actually start to do steroid injections, and you can do them, say, weekly or every 2 weeks for a short period of time. Some people will even do a steroid injection at the time of surgery. I think that one is a little bit harder. You have to have a real talk with the patient because, again, steroids do what? They prevent wound healing. So you could imagine that when I close an incision and immediately inject steroids, you are at a higher risk of having that wound open. It's not a total risk, but it's a slightly higher risk. So it's just a conversation to have, but steroids are a good tool as well as making sure you have silicone sheeting, making sure you do massage and things like that afterwards to kind of help with thick scars.
Cool. How soon after pregnancy can I get my breast implants exchanged for larger ones?
I would say that question also depends on, are you breastfeeding, right? And so let's imagine no breastfeeding. I'd probably say about 3-ish months or so. Really what you're waiting on is to allow the breast tissue to kind of come back to its appropriate size, to shrink and have all the milk and stuff kind of dry up before you kind of proceed. And let's imagine that you are breastfeeding, right? And then the next thing with that, still, I'd say probably about three months or so. In that situation, if it's an individual who, hasn't breastfed, hasn't been consistently breastfeeding, because, when you breastfeed, you sometimes kind of trail off, and maybe the kid is feeding once a day for comfort as opposed to kind of an everyday thing around the clock. Maybe a little bit sooner, as long as the kind of milk production is stopped and you feel like the breasts have kind of returned to a normal size. But I think 3 months is a good starting point to just kind of work around.
I know my friend was wondering that as well, so she's going to be happy with that answer.
Yeah.
And last question, and we are doing good on time. So can you talk about belly button shape after a tummy tuck? Like, what determines the shape? So I know someone said like round or narrow.
You guys got some good questions today. This is also another challenge, right? Because the belly button is also something that everybody notices, right? And even though I can kind of hide the scar of the large incision in the underwear, the belly button is obviously harder to hide. So everyone does, or there are multiple shapes that you can make to try to do a belly button. Some people do an upside down U, some people do a straight U, some people do a diamond, some people do a circle, some people make a straight slit.
Had no idea.
No idea. Right. There are all these things. And the reason why is because they all kind of have their benefits and their kind of drawbacks. Right. And the idea is that every time you make any kind of circle, just for kind of to keep in mind, is that your body wants to take that circle from this big and it wants to narrow it. Right. Like that's what your body wants to do with all scars. And so what we try to do is we try to find ways to break up that scar, right? And you put little darts here or darts there without getting too technical to try to stop the body from contracting that. And so those are the big things that you do to kind of try to give you a good belly button shape. And I'm very honest with my patients. A lot of it depends on how well you picked your parents, right? Some people, as we talked about the hypertrophic scar before, some people scar really well. It doesn't matter what I did to the belly button. Like it's got to look perfect because it's not going to have a scar and it's going to do fantastic. Some people are going to just get a really thick scar kind of around it. And we're going to try to do all types of things that we can do to kind of try to soften that with doing the silicone, doing the massage and things like that. And so those are things that affect the scarring long term. But as far as the shape, we can have all kind of different ways that we kind of create the initial belly button shape. And then over time, because basically we're sewing a scar, which is what your belly button is, to make another scar, they can kind of take a life of their own over time.
So have you seen people use marbles? Is that a thing?
So what's funny enough is, I've heard that kind of is a thing now. But in the past have used, I know people have used erasers,
Oh.
a large eraser. I know that people have used earplugs, right? Like just something to go inside to stent it. So, right, if you think about what I just said, the reason for the marble is that what happens is when you have this big circle or diamond, whatever, your body wants to shrink it, right? But if you are able to put a marble or you put an earplug or something in the center, then it can't squeeze. And the idea is just to hold it open. So I wish I had come up with the marble idea first.
These are the Dr. Hunter marbles.
Yeah, exactly. There may still be time. There may still be time. But
There's still time to do it.
I think it makes sense. I understand the reasoning behind it, and so I tell my patients, because I had another patient who actually asked me about it. I don't think it's a problem for you to do. I don't necessarily prescribe it, but if you did it, I think it's fine.
Last question, since Designed by KG just threw one in. How long after a breast dog can you work out the legs?
So again, twofold. I think that if you are doing things like air squats and you feel pretty good after about a week, 2 weeks, I think it's okay, right, for you to start doing some of that stuff. I think that's fine. Not a lot of stress, because really what you don't want to do is you don't want to get your blood rate, your blood pressure, your heart rate up too early, because then there's always the risk of bleeding. What I traditionally tell my patients is that at 3 weeks in a sports bra, I let you then start doing leg stuff. You can run, you can start to sit on your Peloton. You can't grab the handle, but you can sit on it and pedal. You can do some squats. You can do some leg extensions. You can do a lot of things with your legs at 3 weeks. You just cannot use your arms at that point in time. So that's kind of a general guess. So body weight, maybe a little bit earlier, but at 3 weeks, I kind of let you start having at it.
Very good. I think we got all, let me check the question box. Okay, we got all those questions. All right. We got through all of our questions, and it's only 1 minute until we're done.
I love it. Right
you
on
did
time.
Great.
Perfect. Perfect.
So we're going to get you scheduled again so we can do this on the regular, because I think this is really helpful for a lot of people. I'm going to upload this to the Bustmob main group too, so they can watch this. But thank you so much for taking time out of your day. Like, I know you're a busy man, and I really appreciate you answering questions for the ladies. So
it was a pleasure. I love doing it. Look forward to joining you again.
And next time we will know exactly how to do it on the iPhone.
That's right. That's right. I'll get better on the technical end. I'm much better at surgery than I am dealing with social media and Instagram, but I'll get better. There's room for improvement.
We're all a work in progress, aren't we? All right. Thank you so much, Dr. Hunter.
All right. Bye-bye.
Bye.